unfortunately not an option for all. Some older people require care and assistance, and this government must strive to ensure that appropriate and varied accommodation options and services are offered to older people who want to stay at home and to people who need and support the support of a nursing home. Older people who have worked all their lives and helped this country through previous recessions deserve fair, equitable and affordable treatment. For years, we have all been told that Ireland will have an ageing population. This means a greater demand for services and accommodation assistance, and the Fair Deal scheme aims to ensure that long-term nursing home care is accessible and affordable for everyone, and that people are cared for in the most appropriate settings. To date, I would say that the scheme has been a success, but with an ageing population, increase in demand that exceeds the funding that can be released, we are unfortunately looking at waiting times. While I strongly disagree with waiting times for 15 weeks, I believe that we should look at how we can provide a continuum of care and perhaps a more appropriate funding scheme for older people in Ireland. And by care, I mean care that is complete with the appropriate care services and even social activities that would prevent isolation and loneliness for older people. Let me emphasise here that this government is in fact spending a large amount on this scheme, nearly £1 billion each and every year, 939 million to be precise. This government is committed to providing for old people. However, we cannot have situations known as bed blockers or the inappropriately placed older person. However, I believe the Fair Deal scheme alone cannot address all these problems that are relevant for our older and sick people. Yes, reductions of 35 million have been made in this year's Fair Deal scheme, but 23 million of this funding, of this 35 million funding, has instead been allocated to alternative community services. These services can deliver a greater range of care options, prevent unnecessary hospital admissions and provide rehabilitation to support older people to return home. 10 million has been allocated to provide intensive home care packages, and this is a welcome move. Many older people want to stay at home, and this funding will ensure their continuum of care, their happiness and continued well-being. A further 10 million has been allocated to address funding shortfalls in the provision of public short-stay beds. 3 million has been also allocated to commission 25 intermediate transitional care beds. These steps will help to ensure a holistic approach to providing care for older people. These steps will help ease the pressure of demand on the Fair Deal scheme, and it will help provide for alternatives. Minister, I welcome the review of the scheme, which is currently underway. However, I have been given detailed information that the cost of delivering care in private nursing homes is cheaper to deliver than care delivered in public nursing homes. Why is this? It is also essential that this review considers not only the future funding and sustainability of the scheme, but also how community and residential services are balanced. Minister, the well-being and continuum of care for the older person is and must continue to be the key focus of this government. I know that you, as a qualified doctor, wants the best for our elderly people. Thank you.
Margaret Cathaoirleach, one of the main benefits of this nursing home support scheme for individuals and families is that it gives them certainty about how much the nursing home care will cost. And without this scheme, many families would not know how much caring for their loved one will cost. And indeed, I think it's important that we should put in record that they would know how much they would have to put aside each week so that the elderly parent as Deputy Mitchell O'Connor alluded to, gets the care they need. I have to say, I find it extraordinary that Fianna Fáil are putting this motion before us tonight, given that the party hasn't, when in government, prepared to develop a policy regarding the care of our elderly, and allowing for the fact that Minister Varadkar in this budget has achieved an increase in the health budget, where we're now spending 13 billion on health, an increase of 635 million on last year. And I think it behoves the members opposite, rather than coming in here with a condemnatory motion, to put forward a motion regarding their own health policy around the care of our elderly citizens. And notwithstanding that, Minister, there are problems, as we know, with the Fair Deal scheme. The waiting period in the application to the scheme, when a person takes up residence in a nursing home, and the time of the first payment, I think needs to be addressed. And also during this time, the person or their family end up carrying the full cost of the nursing home, which can prove to be difficult, both emotionally and financially. And I very much welcome the remarks of Minister Lynch last night that the scheme is being reviewed, and I would ask that the ministers in the department would provide a clear time frame for when this review will be completed. I think it would also be useful, in terms of the reference for the review, take account of demographic changes. We all understand that our population is living longer, that our age cohort is increasing. The Department of Health estimates that an additional 1,000 long-term residential care beds each year will be required over the next 7 years. And this places an additional pressure on the funding requirements, but it is something that must be planned for as soon as possible. Something that G didn't do in government was plan for the future, and Minister Lynch last night was quite right about that. The review will also consider the effectiveness of current methods of negotiating and setting prices, which I think must be up for discussion. It has been described to me, Cathaoirleach, as a cost-plus system, a system that encourages a high cost base and does not incentivise efficiencies. And I say that as somebody who's visited a number of nursing homes in my own constituency recently. We must ensure that this process is about real negotiation that enables nursing homes to have the financial capacity to reinvest so that they can maintain and improve the lives of the citizens that are now living in their facilities in their now new homes. And I think, Minister, we should also look at enabling a third-party review or arbitration of the negotiating process, which will, I think, help to ensure fairness. One issue that I think we need to be conscious of is the recruitment and retention of qualified staff, in particular nurses. I know from speaking to nursing home owners, Cathaoirleach, that as soon as the HSE advertises and recruits nurses, they draw from the private nursing home sector. And as we know quite well, the private nursing home sector can't offer the same package of remuneration and terms and conditions. And I would hope that the review process would also examine if this should be a factor considered when negotiating and setting prices. I do hope that the review process will help to develop a comprehensive approach to the care of our elderly citizens. I know that one aspect of the review is looking at extending the scheme to community-based services and other sectors like disability and mental health. I think it is very helpful that it is being considered that these services are every bit as important as the nursing home care. And I would share some of the concerns of Nursing Homes Ireland about this proposal. Given the forecasted increase in demand, we must ensure that funding for nursing home care is not diluted. Maybe the review should also consider if it would be better to establish a similar but separate scheme for community-based services. Earlier this year, the Health Committee, which I chair, published a report on the end-of-life care. Some of our recommendations related to access to long-term stay care facilities. And I would ask the Minister for Health to consider these proposals in the context of the review of the Nursing Home Support Scheme. The current scheme deals with everyone on a chronological basis, but it might be appropriate to prioritise some patients based on medical condition. Our Health Committee, Cathaoirleach, suggested that this should be done for palliative care patients, enabling them to access residential care in a timely manner, thereby facilitating their final medical care in a more appropriate setting. The committee also suggested that the consideration should be given to extending the definition of long-term residential care services and the range of services covered by this scheme. I've already referred to this, and it has been looked at, and in my final sentence, I do believe that finally, in reviewing the current Fair Deal scheme, as evidence-based cost of care model could also be used.
Yes, thank you, Cathaoirleach. And I want to first of all compliment Deputy Billy Keller on putting forward this motion for which he ably proposed yesterday evening. I think there's been a lot of praise for the Fair Deal scheme. It's not the Fair Deal scheme that's the problem, it's the whole waiting list operation. Right from the first go, you're waiting to get into a nursing home, as many elderly people and families have told me, because of budget cuts. And then, of course, what's called processing an application is now taking longer and longer. Processing an application was a very simple procedure some years ago. And at present now, I understand there's 2,083 people on the scheme's national placement list, with a waiting time for funding approval of 15 weeks from the date of determination. We have to ask why this is happening, and why in my own constituency, a constituent of mine told me that their elderly aunt was approved on the 9th of July 2014. The funding was made available on the 29th of October 2014, 16 weeks later. So this is the kind of delays that people are facing, and it is very disappointing to hear of hundreds of people waiting for funding, that funding to be paid. To have a person go into a nursing home and waiting for funds to become available really is a very serious situation, and of course it leads to financial hardship. You've heard figures of 12,000 or 13,000 euros that people have to pay, and payments are not backdated as they were under the Nursing Home Subvention Scheme. So we have to ask, I think, how this crisis could be avoided, and what are we going to do to make this situation better. I know funds were taken away from the Fair Deal scheme to community care and home-based packages. I would like to see both areas funded properly, but certainly with a diminished budget, we're going to have problems losing beds, and the question arises is, as I said, what are we going to do about this? In County Galway last week, I think there were only a few people approved for the Fair Deal scheme, and if we have a situation where now a minimum of additional 7,600 beds for long-term residential care will be required between now and the end of 2021, we do really have to look at careful planning in this area. Based on population projections, there will be a significant national deficit of long-stay beds by 2016, based on a target of 4% of older persons in long-stay care. And of course, we do need also carers to provide for that care. Between 2009 and 2012, approximately 340 new nursing beds per annum were available, and this compares to annual increases of approximately 1,000 per annum in the years prior to this. So we certainly are going to hear more situations of older people who are not getting beds, not getting the Fair Deal, and indeed some of them would like to be cared for at home, but they have to get supports there also. We know that nursing homes are a more appropriate and affordable setting than an acute hospital. I think there's a multiple of between 5 and 8 times the cost of providing nursing care in a hospital compared to a nursing home. And indeed, I might say that nursing homes have raised with me and with many colleagues the level of funding that they get. Even in the same county, even in the same town, there are different levels of funding for a nursing home, which is something I think should be investigated. But if you take the average cost now of 750 euros per resident in a private nursing home and a weekly cost of 6,000 plus in an acute hospital, you can see the difference in those figures. So I hope that we're not going to have a situation anymore where people cannot access nursing homes and they remain in acute care, and of course it's going to cost more money to the state. In County Galway, the numbers waiting at September 2014 to access the Fair Deal was 85 people, an increase of 286% on September last year. So I hope the Minister will plan for a better future on this. I noticed that Dr. Tony O'Connell, the National Director of Acute Service HSE, he referred to the fact that the HSE were hampered in freeing up beds because patients fit for discharge cannot leave and have no nursing home places due to cutbacks. It costs hospitals, he said, around 200 euros a day to care for patients. It drops to 100 once they are in a nursing home. So I'll just say finally, that, you know, there was a lot of people attacking this Fair Deal scheme when it was brought forward in 2006. I think it was called a death tax on the elderly, or a death tax of 15%. the 5% each year for the first 3 years. Of course, this government put it up from 5% to 7.5%. So it's now 22.5% over 3 years. And I think that shows really that we haven't really thought out how we're going to fund the Fair Deals scheme, and we should have a clear policy on it in the future. Good morning.
Well, I welcome the opportunity to contribute to this debate and compliment my colleague for bringing forward this debate. I think it's extremely timely, given the current crisis that faces the Fair Deal scheme presently. But before I speak to that, I want to take the opportunity to thank Minister Varadkar for rowing back on his original decision to cut funding to St Christopher's Hospital in Longford. But you're getting the credit for intervening at this stage. You're getting the credit, so you might as well take it, Minister. But I can say that I was in Longford last night, and there was a couple of hundred people at the AGM, and there's a lot of parents, a lot of service users that are very relieved by the intervention, and that is welcome. But in relation to this debate here that's in front of us this evening, over the last number of years we have repeatedly heard the mantra from An Taoiseach that he wants Ireland to be the best small country in the world to do business in. But what we never hear from the Taoiseach is, and why would we, and we should hear, what about being the best small country in the world to be a child in, about being the best small country in the world to grow up in, the best small country in the world to raise a family in, or the best small country in the world to grow old in. And certainly, when you look at a lot of the policy decisions taken in the last number of years, it is not the best small country in the world to grow old in. If you look at the savage attack to the number of medical cards for our senior citizens, not alone have we removed thousands of medical cards, we have removed certain items covered on the medical cards. We have hiked the prescription charges. We have abolished the free telephone allowance, something which is leaving older, vulnerable people in an awful circumstance, particularly in rural Ireland, because their personal alarm and their panic button is reliant on having a landline in their house. And that has been abolished by this government. We also seen the cuts to the housing aid for the elderly and the housing aid for people with a disability. They've cut the budgets, but they've also modified the criteria, the eligibility criteria, which leaves it far more difficult for anyone to avail of this grant. We see a reduction in the electricity allowance and the introduction in a property tax for our senior citizens. And that property tax takes no accountability of a person's ability to pay. And an older person might live in a valuable house, but to have a finite weekly income. And that finite weekly income, in many, many cases, is only €230 a week. And they simply cannot afford the additional stealth taxes and cuts that this government has introduced in the last number of years. And not alone are we saying it and making it even more difficult for people to live at home, now we are saying to our elderly, do not get sick. And if you do get sick, be prepared to wait. And I believe there's a concerted effort by this government to leave people languishing on the waiting lists. And I think that's morally wrong. The Irish, our senior citizens, our parents, our grandparents, have made this country what it is today. And they deserve to be treated with the decency and the respect. And people talk about the Fair Deal. And the Fair Deal was introduced by the previous government so that we could ensure that our elderly people, when getting sick and in ageing, could have peace of mind that they would be looked after in their old age. And last year, Minister, the previous minister decided to withdraw and divert 23 million from this budget to the community budget. And that is welcome. It's welcome in the fact that, where possible, older people should be supported in the home. But that community budget needed additional funding, because when you look in the Longford Westmeath area, the home help hours were reduced from 331,000 home help hours in 2011 to 245,000 in 2013. So at a time when the population is getting older, we have a savage cut to the number of home help hours that are being provided. And that flies in the face of what this government is saying. They're saying that they're taking the money out of home help or of Fair Deal to support people living in their own home, and they're not actually doing that. But what I'm amazed at is why it always has to be that we have to take out of one scheme to the detriment of others. Why has every section in the HSC, why do they all work in silos? Why is it that there's no consideration given for the consequences of a decision in one department and what effects that decision will have in another department? We have acute hospital beds blocked because families can't take people home, because elderlies with no families have no home to go to. And not alone are the people blocking these beds, they're not getting the appropriate care. They're susceptible to picking up viruses and bugs. They're not receiving any activities during the day which will stimulate their mind. And they're receiving no entertainment. And quite often, they're left languishing in acute hospital beds beside people who are terminally ill and dying beside them. And if you don't want to think of the consequences of the well-being of the patient, well then surely the economic consequences must be part of your considerations. And we're aware that the cost of keeping someone in an acute bed is approximately €200 a day, while the cost of keeping somebody in a nursing home is only €100 a day. But the budget of the hospital is no consideration to the budget of the Fair Deal. And the budget of the Fair Deal is no consideration to the budget of the community health and the disability sector. And recently I saw a case, a young man who was in a serious accident, and thankfully through a number of months in a rehabilitation setting was able to be discharged home. But why he was left waiting for a number of months, despite the fact that he was being able to be discharged home, because there wasn't a sufficient budget in the community and the disability sector to bring him home. And he was left at a far, far greater cost to the state in an inappropriate care setting because one would not talk to the other. Now, Minister, that doesn't add up. I have plenty more to say, but unfortunately I can't say because I ran out of time.
Thanks very much, Lascaux Corla. Minister, I think one of the distinct advantages of the Irish political system is the fact that the vast majority of public representatives are very much in touch with how people are feeling on the ground, and indeed the effects of decisions of government and decisions of state, how it impacts on their everyday lives. Some people criticise us, they call it clientelism, and they hold us to account saying we're wasting our time doing our clinics. But it is a fact, and I can tell you this and I can attest to it, that every week when I do my clinics, similar to other public representatives when they do their clinics, the three top items that come to my attention in my clinics across County Limerick are medical cards, access to Fair Deal, and the accident and emergency crisis which pertains in the University of Limerick Hospital. And I can tell you, as a public representative representing Limerick along with others, the elderly community in Limerick are very worried. They're a very worried bunch of people because of the situation and the crisis which has developed in relation to access to Fair Deal. When you consider that in January and February of this year, people were waiting 4 weeks for approval. In April and May, that had risen to 7 and 8 weeks for approval. In June to September, it rose to 12 to 14 weeks, and in October, it peaked at 15 weeks. An absolutely unacceptable state whereby people have to wait that long to have their funding approved. And the catch is this, because unfortunately many of those people have to, by virtue of having no other choice, by virtue of their physical condition and their infirmity, have to go to a nursing home. They're then caught with the cost of having to carry the cost of those nursing homes while they're waiting to have funding allocated to them. And that just simply is not good enough. And you, Minister, know, and I know, and I think the people who are participating in this debate tonight live in the real political world, that politics is about choices and it is about priorities. And what we saw in the budget a number of weeks ago was a giveaway to people who earn 100 grand, 90 grand, 80 grand, in excess of 100 grand. We'd up to 600 million euros of a giveaway of tax cuts in the budget. And yet at the same time, our elderly community in Limerick, across the Midwest, across the country, are facing a funding shortage for the Fair Deal scheme. I think that is wrong. The people out there know that it is wrong, and I think that you, as Minister for Health, need to take some steps, some positive steps, to try and address that. It simply is not good enough. You gave away money in the budget by way of a tax break to the high earners, and we're penalising the people who have built this country. Minister, I also mentioned to you the crisis of A&E in the University of Limerick Hospital, and I'm sure you are well aware of it. And I would ask you, when you next pass through Limerick or visit Limerick, to take the opportunity to come to the University of Limerick Hospital, to see the absolute chronic conditions which nurses and doctors and staff and patients have to suffer when they attend at A&E. The sheer physical built environment within which the A&E operates out of is so not fit for purpose. It's bordering on criminal, Minister. We've had a situation where patient support groups, both national and local, are calling public meetings in relation to it. And I know that it is an issue that you know a lot about and that you care about, and I would ask you to seriously take steps when you next come to Limerick to address that, to see it at first hand yourself. You may have seen it already that I'm not aware of, but if you haven't, please take the opportunity to call there. I'd also like to mention to you, Minister, and I've mentioned it to you before, the situation in relation to primary care. We have to, through the HSE, have a serious impetus in terms of the rollout of our primary care centres right across the country. And the model which has been deployed by the HSE is bureaucratic. It's throwing too many impediments, in my view, in the way of general practitioners getting themselves organised, getting themselves to a situation where they can formally enter into arrangements with the HSE to have primary care centres. And where there are primary care centres, and there are many of them, they're an outstanding success. But I think that at the moment there's a bureaucratic nightmare with the property estates management section within the HSE in terms of how they interact with the general practitioners, and the hoops and the various steps in the process that the general practitioners have to go through to pull together a scheme of arrangement with the HSE to get a primary care centre up and running. That is something which I think you should look at as Minister, because, as I say, where the primary care centres are up and running within those communities, they are hugely valuable. And what will they do? They will serve to alleviate the people presenting at A&E, as you well know. They will serve to address the issues of the elderly people within our community and hopefully keep them from having to access the Fair Deal. So where you have more impetus within our primary care centres, if you can get enough of them up and running, you will have less pressures right across the remainder of our health service. Thanks very much.
Chairperson, I would be grateful if you would give me notice of my last 2 minutes. Minister, I don't know if there's any truth to the rumour that, it's not a scurrilous one, that you somersault in celebration down the ministerial corridor on a daily basis. You being the main benefactor of the mess of Irish water. And that's a mess that has been delivered by your own party and those limping with you in government. And what you have successfully managed to do, Minister, and I know behind it all you agree with me on this, what you've managed to do is distract the public and the media from the mess that you are covering up in the Public Health Service. And it's a mess. Now, I know you're recently. Well, you know, you were on a different brief. I know that, but I would say to you, Minister, that while the public are consumed with the crisis in Irish water, and your own department is failing to address the concerns that have been highlighted here this evening, Minister, you're going to have to up your game here and start addressing this. You just can't cruise into the next general election hoping that you are not going to be held accountable for what's going on in the health service. Now, Minister, on Monday, I, like yourself, am prone to Googling. And I Googled Mr. Leo Varadkar and Irish water. And since the beginning of this month, you come up with comments on 30 separate occasions on Irish water. And when I put in Mr. Leo Varadkar and the Fair Deal scheme, you come up 4 times. That's what's going on here, Minister. You are deliberately stoking up a distraction from the mess. Yeah, you are. And I know it's not any confidence that you have in the Minister for Environment, Alan Kelly. I'm sure he's shaking in his boots tonight, because you clearly don't give a damn about the crisis in our nursing home system. You don't. You are more concerned about flagging up the debate and sticking your nose into a debate and absenting yourself from addressing the situation that has been highlighted here tonight. I suppose, Minister, you see, I see the real distraction. And the real distraction is the demise of your own political party and the opportunity you have to take out Enda Kenny as leader. That's what's going on here. That's why you're out in Irish water. Because you certainly don't want to talk about health. You certainly do not want to talk about vulnerable old people who are carrying a burden about your inactivity in addressing the whole spirit of the Fair Deal scheme. And Minister, just to bring you into some Cabinet collective responsibility, the waiting list that you are responsible for, the ones that you deny exist, the ones that were recently published, you denied that they were stoked up and fiddled. The documents you sit on, the direction to cover up and smuggle the waiting lists, that's what you're at. Camouflaging the disaster, that's what's going on, because as Deputy Collins said, we're meeting the consequences of the camouflage system. Minister, you're a GP, I understand, and it's an area that's suffering greatly. And as a deputy from rural Ireland, I'd ask you to pay some immediate attention to the crisis that's emerging with the exodus of GPs in this country. But I think that pales into insignificance relative to the loss of our young nurses who have gone through a qualification system in Ireland, to the cost to the Exchequer. But, of course, not that you're responsible, you weren't at Cabinet the day that you gave them the yellow pack deal. And that's why Irish nurses won't stay within the system, and it's causing a crisis. They're voting with their feet and they're going to work in England after the Exchequer takes the liability and costs of training invaluable frontline staff. Minister, the motion here concerns tonight a part of the health service that you only spoke about since the beginning of this month 4 times. But you spoke 30 times. You're on your iPad there, you can qualify whether I'm correct or not. It's probably greater because my research was effective till Monday. And I'd say you spoke more times on Irish water in the last 48 hours than you have about the Fair Deal scheme. And that's what you care about elderly people in this country. That's what's going on here, Minister. And you and your government originally committed to a review. You smirk, but you're not smirking at me. I know you have disdain for people like me. But I have a mandate to be here to say what I'm saying to you, because I'm saying this on behalf of people who are stuck with the liabilities that you are ignoring. That's what you're doing. You can smirk all you want. I know it comes natural, but I have a mandate to say what I'm saying to you. Yeah, there you go for the water again. You have an unwillingness. You have an unwillingness to deal with the reality of the situation. Unlike your great leader who wants to let Paddy know. You've got to let Paddy know, but you know, you're failing to inform yourself of the scale of the situation, because I know you as a decent person, and if you have this information like we have it, then you must find it very difficult to put your head on the pillow at night. When people are being early discharged out of hospitals, where wards are being closed as a consequence of budgetary restrictions, and you're precipitating the accelerated discharge of vulnerable and sick people who don't know their rights. and they find themselves in a broken care pattern where their children have emigrated as a consequence of our austerity, yours and mine, where you have slashed home helps, where you have broken the carers arrangement, and yet you deny the problem here. Minister, in July of this year, the department advised your friend, your previous minister, the one that I said to you on Tuesday, you shifted the blame onto him. This mess. You were advised about the budgetary shortfall, and you've done nothing. That's your legacy so far. Your legacy so far as Minister for Health for this month is that you've spoken 30 times on Irish Water, and you have done nothing, nothing for senior citizens or their domestic circumstances. So you can smirk at me and lie behind that ideology where somebody has to go and pay €1,000 a week because of an administrative, a deliberate strategy. You see, Minister, I have somebody in the department who rang me to tell me what really is going on.
Thank you.
And this is an administrative decision directly from you to tell them to slow it down. It's true, Minister. You have fingerprints. You are the author of this decision. Go to the...
You're over time. Thank you.
No, the only person that's over time is that gentleman across there.
Excuse me.
Yeah. Go and take up the glass of water. Go on to Facebook, will you?
Sorry, will you switch off the microphone, please? Sit down and behave yourself. Deputy Smith, thank you. Will you sit down and behave yourself and speak through the chair in future? Thank you, Deputy Smith.
Thank you, Corda. I'm glad for the opportunity to make a short contribution on this important motion before the House this evening. And our party spokesperson, Deputy Kelleher, has put a very reasonable and fair and important motion before the House. And once again, Deputy Buttimer talked about us having a motion that wasn't dealing in the real world, but it's very much dealing in the real world. Because if he had to listen to colleagues from his own party speak earlier, all of them pointed out the difficulties that are arising with the Fair Deal scheme. All of us who do constituency work have queries every day of the week in regard to the long delays in accessing nursing home care. Deputy Buttimer also said that there was no investment during the lifetime of the Fianna Fáil governments. Well, that's absolutely incorrect. I can speak for my own county in particular. We had major nursing home developments in the early 2000s in Ballyconlin in Virginia, and alongside those public nursing homes, when they were being constructed, primary care centres were also built and provided, and are providing an excellent service in those two particular towns and for their catchment areas as well. Many of the speakers on all sides spoke earlier about the desire and the aim of all of us would be to keep as many people at home as long as is possible. And we all support the maximum support for home support packages. But again, there has been terrible pressure in regard to the reduction in home support hours. Many times decisions are made where home support hours are approved that make no sense on the basis of half an hour, 45 minutes or whatever care for some person who needs much more care than that at any particular time. Again, one other issue, and I don't think it was referred to this evening, was where there could be a better whole-of-government approach in regard to housing adaptation grants. Far too often local authorities, applications are with local authorities for a particularly long time, and unfortunately it causes undue stress and distress and annoyance to families and obviously to the person who needs that care and attention. Because if house improvements are to be carried out, they should be carried out at the time that the older person needs those extra comforts and facilities in their home, not that they have to wait for years for them to be delivered. And it causes so much frustration and annoyance. The Fair Deal scheme was introduced a few years ago, and it has proven to be a very successful scheme, and it needs to be funded adequately. It was brilliant at the time because of the ageing demographics in this country, and it was innovative, it was progressive, and it was based on providing financial support to people needing long-term nursing home care, being in a private or public facility. and it allowed people to make a small contribution to their care and the state taking on the major burden. Indeed, it's quite ironic that at the time the then Fine Gael leader on Taoiseach, Deputy Kenny, spoke about a new death tax. It showed how out of touch he was in relation to that particular policy. The 3-year cap has also a very good provision within the scheme. It's a very good provision. I know that in my own county, there has been in my own Cavan Monaghan constituency, there has been a dramatic increase in the number of people on the Fair Deal waiting list. It has increased by 300% in 1 year. In a relatively small area, there are about 83 people on the waiting list as of September. A massive increase over a short period of time. And those are the families that are contacting the public representatives that are very worried as well. And this whole area needs to be addressed. And I hope that in the service plan, which the HSE will produce shortly, I hope that there is adequate funding put in place for this very important scheme. Like elderly people whose health, whose lifestyle is deteriorating, the last thing they or the families need is the constant worry about getting access to a nursing home bed when they need it. I've had cases over the past few weeks in particular where some people from Cavan Monaghan who had been in Our Lady of Lourdes Hospital in Drogheda and whose step-down facility was provided in County Louth. You know, County Louth is quite a distance from most parts of County Cavan and from Monaghan as well. So that shows the type of pressure that there is on nursing home places, on step-down facilities, and also that attendant pressure on those families who don't need extra stress at a time when their loved one's health is deteriorating. Thank you, Ceann Comhairle.
Thank you. Minister, you have 5 minutes.
Thanks very much. I'm often complimented on my political skills and abilities. I think we have a very interesting one tonight. I didn't think I was capable of organising the entire Irish water debacle all on my own, just to cover up the problems in health, which I'm certainly not trying to do. And certainly, if Deputy Keaveney wishes to substantiate his allegation in any way, I'll ensure that the person who has made it, or supposedly has made it in my department, is fully protected, should he wish to substantiate that allegation, which I believe to be entirely false, and I'm sure he won't substantiate it. Ciara, I'd like to thank you very much for giving me the opportunity to address this House on this important issue. First of all, I want to respond to some of what's been said in the debate this evening and last night that may be of interest to members. Last night, Deputy Fleming drew attention to the need for better links between hospital and community services, and I strongly agree with that. Effective links in this area are essential if we're to get maximum benefit from available resources and provide the most appropriate care to patients. Improving this area is very much on the radar of both the Department and the HSE. The Deputy also called for a dialogue with private service providers who feel they're being locked out of essential consultations on future plans. I fully subscribe to the principle of dialogue and consultation, and stakeholders already have access to officials in the Department and indeed its ministers. For example, public consultations preceded the review of the Fair Deal and took place during the preparation of the dementia strategy, and a further meeting for private nursing home providers and my officials was agreed as recently as last week, and I addressed their conference myself last week. A number of deputies have argued that moving suitable patients currently in acute hospitals to less expensive nursing homes could free up significant funds. This is a nice idea, but it's too simplistic and misunderstands how health spending works. It is absolutely true that a nursing home bed costs less than an acute bed, but it's invalid to argue that when we move a patient from that acute bed, that we take that money and give it over to a nursing home or elsewhere, because the vacated acute bed will in fact be filled immediately by a new patient, perhaps one of the many on our waiting lists. So people who make the argument that it's cheaper to have patients in a nursing home than in a hospital don't quite understand how it works. Their economics and their logic only works if after you discharge the patient to the nursing home, you then close the hospital bed behind them. And that's something I'm not willing to do, not at a time when there are patients on trolleys, and not at a time when there are so many people on waiting lists. I want to keep all those beds open for those who need them. So there's no false economy here, and the savings that people suppose to exist, unfortunately, do not. Deputy Donovan was concerned that outsourced home care services cost the HSE far more than is paid to workers providing the service. These services are provided by the HSE are procured by the HSE by competitive tender and include an assessment of the tender's capacity to provide a quality service. The objective in the future will be to identify providers in each region who can provide home supports on a most economically advantageous basis, and HSE will be responsible for that. Deputy Quaylen claimed that the review of the Fair Deal has been completed and is being withheld. This is not the case. The Fair Deal review is not being completed. External consultants have reported on some specific aspects of it, but this is and was always only an input to the overall review. When the review is completed, the input from Deloitte and Touche, the consultants in question, will be published alongside it. I expect the review to be completed within the first couple of months of next year. Deputy Quaylen also expressed concerns that older people formerly enjoyed universal eligibility for public facilities, and this is now removed. That's not the case. In fact, universal eligibility for public facilities remains, but is now augmented by universal eligibility for any private facility that can meet their demands. Patient choice is central to this. Deputy Mitchell O'Connor asked why it costs more to have somebody in a public nursing home than in a private one. I'm not sure why that is. In part, it may be down to staffing levels being higher in HSE nursing homes. It may be down to pay scales. But I expect the real reason is the dependency ratio, that people who are in public nursing homes and HSE nursing homes often have much greater and much more complex needs. And I think that's often missed sometimes by people suggesting that the private sector can always do things cheaper. It doesn't always. They don't always compare like with like.
I'm afraid we're running out of time.
Really, just to sum up, Ken Corley, I just want to say that both Minister Lynch and I are very aware of the very long waiting list that exists for the Fair Deal. We're not satisfied with it, and we're not happy with it at all. And we are working very hard in the context of the service plan to do everything we can to reduce the waiting list in the coming weeks. Thank you.
Thank you. Now call on Deputy Calleary.
Thank you, Controller.
I understand you're sharing your time.
Sharing with Deputy Keller. I'm
10 minutes and 5, I'm told.
Change 7 and 8.
7 and 8.
Yeah.
You're 4.
I'm taking 7. Thank you, Controller, and I want to thank Deputy Keller for giving us the opportunity to discuss this issue, which, as Deputy Collins has said and many people have said, is a major bone of contention currently at clinics and right across communities. I think, Minister, since your arrival into Hawkins House, you've approached the role with some degree of candour and straight talking, which contrasts greatly with that of your predecessor. But we will get a chance to adjudicate how effective that has been when we see the service plan next week. And at the service plan, at the heart of it, must be a real commitment to overall community care, and within that, elder care. I heard you speaking just there now about your wish to keep open beds, and particularly beds for areas where there's surgery needed, where the waiting lists are growing at an exponential rate, and we all support that. But this was what was happening under the Fair Deal scheme when it was working well. And the HSE management and HSE hospital management, and I want to pay tribute to the hospital management in County Mayo, where they have had a very good step-down process from Mayo General, using the 3 community hospitals in Balnab, Mullet and Swinford, and using the community nursing homes. But they found in Mayo General Hospital they were so good at doing it that their budget was cut, and they were penalised for actually being able to deliver on the targets. And unfortunately, the system of step-down beds, which is so essential, particularly in large rural counties such as ours, has depreciated a lot during the year. And we have substantial waiting lists beginning to build in the Shelta University Hospital group for things like orthopaedics, things like ophthalmics, and for surgery that could be done where beds available. The change in Mayo is particularly stark. We've gone from 18 people waiting this time last year to 71 today. And that's 71 families across the county who may not have the money, who are being forced to leave their families in a hospital bed that they don't want to be in, or who have to stump up very large sums of money in order to give their loved one the care they need. And that's just simply not fair. And when you talk about economic recovery and you talk about fairness, when 71 families are waiting to get the go-ahead to allow their loved one to stay in a nursing home, that's not recovery. and that's not the kind of recovery anybody in this House would surely support. You speak of community care, and Deputy Troy made a point earlier about the HSE and its very unique ability to work in silos and not talk to the H doesn't talk to the S, and the S doesn't talk to the E, and the E doesn't talk to anybody, frankly. You have a situation where community care, in terms of home help hours, and that seem to operate separately from the Fair Deal scheme, even though they should be absolutely and utterly linked. And home help hours in my county have been cut in some instances. I know of people getting 30 minutes a day. You literally hardly be in the door before it's time to go again. And if home help is to be effective, it has to be related specifically to the client involved and not done on some sort of idealistic management information system where the person doing the home help is running around like, I don't know what, trying to get her half hour done here or half hour done there. Home care packages should be tailored to the specific needs of the patient, not done to the specific budget of the relevant community care department. And at the moment, unfortunately, it seems to be that the budget is winning out. And Deputy Smith's point is also very important. Housing aid for older people and adoption grants are operated through the local authorities. Now again, we're particularly lucky in County Mayo. And I pay tribute to Mayo County Council, who, when it comes to housing adoption in particular, use a very good system. If somebody needs housing adoption done to get them out of hospital, then it is done, and it is done quickly, because they manage their budget to allow for money. And I brought Minister Lynch's predecessor minister, former Minister Hoyt Brady, to see how it works there, and it's something that needs to be worked. But unless there's some sort of togetherness in the system, then that's not going to work. And we end up in a situation like we have on the Fair Deal scheme, this appalling delays. I heard the usual choir of Fine Gael backbenchers with their choral notes from the Fine Gael press office. The usual thing, 3 years later, the story hasn't changed, the singers have got worse, and the tune still doesn't make sense. This, ladies and gentlemen, happened on your watch. The delay and the moving around of funding, which has resulted in these delays, happened under Minister Riley's watch, your deputy leader. And no matter how much crowing you do, how much complaining you do, you cannot ignore that reality. And the thousands of extra families who are waiting on a decision on Fair Deal and who cannot get a bed in nursing homes tonight can only look at one man, and that is Dr. James Riley. He made the call, he made the decision. So, Minister, when you publish your service plan, you've got to make sure the decisions you make do not have that kind of impact on people, and do not have a situation that will result in a 300% increase, as it has in my county, in people awaiting care next year. I want to come back to the issue of GPs. Again, essential to community care, Minister. You spoke recently about getting all sorts of offers from Canada to go over and work for very big amounts of money. The difficulties in getting a rural GP service and in protecting the rural GP service are very real. And unless you look at the system differently, unless the HSE looks at that system differently, unless we reintroduce, as a matter of policy, the rural practice allowance, rather than the HSE having to apply for every post to get a rural practice allowance, depending on who applies for it, then we're not going to make it more attractive. We should make it attractive. It is a fantastic challenge for people to work in a rural area, but it is a professional challenge which needs to be given the kind of financial and system support which is not there at the moment unless people go looking for it. Minister, this government has made some particular attacks on older people, and I want, medical cards, cutting the phone allowance, the cuts in the bereavement grant. Every kind of possible support for older people has been targeted by this government. I don't know what older people did to you, but they clearly did something. But finally, Minister, on medical cards, again, a very important part of community care. You cannot say you have a recovery when a Down syndrome child, when their parent is forced to go to the national airwaves to get their medical card dealt with. And that's what happened last week. A case that I've been dealing with through the system. The parent, the mum, had just no more patience, and she went and spoke about her case in the national airways, and it worked. Your office contacted her within hours of her being on the radio. The local government deputy contacted her within minutes of her being on the radio. Parents shouldn't have to do that. Parents with Down syndrome children shouldn't have to do that. And in your service plan next week, do something for parents of disabled children. Thank you.
Thank you. Deputy Kelleher.
Thank you. Just to say at the outset, I'd like to thank all deputies that spoke on this particular motion. We got a lot of criticism, Minister, from some government deputies about us tabling this motion. They said that it was ill-timed, that it wasn't constructive, that it didn't come up with any solutions, and yet then they came on to speak to the substantive issue, which is the difficulties that people are facing in accessing fair deal beds. The waiting lists speak for themselves, Minister. It has gone from a situation where people were 560 people were waiting in January for 4 weeks, and we're now at a situation where we have over 2,100 people waiting 15 weeks. So all in all, Minister, this particular issue is very much to the fore in people's minds. It is affecting huge cohorts of people out there, and particularly people that are very vulnerable. Now, Minister, I described this morning in the order of business when I asked Taoiseach that we would have a debate on the issue of health, the HC service plan that's to be published next week. I described the programme for government as a book of fiction. And the more I read it, Minister, I realise that really this is almost a fraudulent sort of programme for government in the context of what was said. Investment, care of older people and community care. This is under the heading of fairness. I just want to quote a bit from it. Investment in the supply of more and better care for older people in the community and in residential settings will be a priority for this government. That is a stated mission of this government in this programme for government in elderly care. It then goes on to say additional funding will be provided each year for the care of older people. This funding will go to more residential places, more home care packages and delivery of more home help and other professional community care services. The Fair Deal system of financing nursing home care will be reviewed with a view to developing a secure and equitable system of financing for community and long-term care which supports older people to stay in their homes. Now, that is the stated mission of the programme for government, as endorsed by the Parliament in 2011. Now, Minister, you're heading into your 5th year in government, and it's backwards we're going. Yes, come next. You're heading into your 5th year in government. You'll be heading into your 5th year. Well, you count it, Minister. You count it, Minister. You're in your 4th year. You're heading into your 5th year. You're heading? Yes. Yeah. Yes. Yes, you are. Yeah. It's a 5-year programme. Work it out, Minister. Work it out. So much fun, you don't know. Yes. So you are heading into your 5th year in government.
Maybe an address through the chair.
Well, Count Cora, they will be heading into their 5th year in government. And the difficulty is, it's backwards we've gone in terms of providing community-based funding for nursing homes, for home care packages, home helps. And all in all, this government has been very mean in its approach to older people. And reference has been made by a lot of deputies in this House, and particularly on this side of the House, with regard to medical cards, access to GP services, funding for community home care nursing home packages, home care packages and home helps. There has been a systematic assault on the level of services and supports for older people in our community. And this is really highlighted and reinforced by the fact that we have 2,200 people tonight waiting 15 weeks for approval to access a nursing home bed. And the sinister element in all of this, Minister, is that people simply need a nursing home tomorrow, the day after, next week, and they will wait 15 weeks for approval. And if they have to access a bed in a nursing home, they will also be charged up to €15,000, while your policy of delaying the application process continues at a pace. And the reality here, Minister, is you can talk about this cap, this famous cap. This cap was a year decision. It's not cast in statute. It's not cast in stone. It's there for a purpose. And the reason it is there is because you decided last year, as a collective in terms of the budget that was passed in this House, that you were going to reduce the level of funding made available for the nursing home support scheme. It is stated in the HSE service plan that there would be a reduction of 700 beds. So all this was very evident from early last year, that we were going to have difficulties. It was highlighted by members on this side of the House. It was highlighted that the budget was not sustainable in the overall context, but it was also highlighted that it wouldn't be sustainable in relation to the Fair Deal scheme. And that's why we're having this debate tonight. It is because ye prioritised and ye decided that funding should be diverted elsewhere. So, Minister, this is about choices, And the choice that ye have made is trying to buy certain cohorts of the electorate by tax reductions and by other means of garnishing support out there in the community. And we know what you're at. You have the focus groups. You know the areas that you want to target with regard to the people that you're claiming to represent. But in that crossfire, older people are suffering day in, day out in the context of waiting an inordinate length of time to access a nursing home bed. And that simply is disgraceful. Now, I said last night, Minister, that the Taoiseach in 2010, 4 years ago, in 2010, stood outside in Molesworth Street, and he said to the people that were there in their droves, 30,000 people who were protesting with the government at the time because they took away the universal right to a medical card for over 70s. And he shouted, "Shame on them, shame on them, shame on them," referring to the government of the day. And he was passionate in it. And the then leader of the Labour Party, Deputy Gilmore, was equally passionate. And, you know, I almost believed in myself. I almost believed in myself.